today. So we've got Nurse Bina with us, we've got a new patient, Tina, who we have not seen before, and we're both live on TikTok and YouTube. So we're going to do a couple of things today which we've never done before. We're going to show you the whole process from start to finish. So Tina has never been in this clinic before, she's never been a patient of ours, and the nurse is going to show you the whole process. And the reason why we decided to do that is to show you what goes on. So Nurse Bina is going to do the procedures today, and those procedures will depend on how the consultation goes. So the first thing that we're going to see happen today is the consultation with this particular patient, and then the nurse will make some decisions about what treatment she's going to do. We think we know what they're going to be, but who knows, because it's all live. Yeah. So talk us through, Bina, what you're going to start to do in terms of the consultation.
So generally we first ask how the patient's medical history is like. So how is your medical history?
It's fine. I've got no health issues.
Health issues, okay. Do you take any medication?
No.
No? Okay, so overall health, great. Yeah.
Seems to be, yeah.
What about like your skincare?
I don't have the skincare, I literally just wash with water. That's it.
Okay.
That is it. I don't use any creams or anything like that. I used to have eczema before, and I used to use soap creams years ago, but that's about it.
That's about it, okay.
Yeah.
And so today you have an idea of what you kind of...
I do. I have got some insecurities on my face, but I've never had anything done before.
Okay, so what was you going to say?
So, and I was just going to repeat, so good afternoon, we've got a few people just joined on, there's a few hundred on already, so welcome to 65Medical. For those who've never seen us live, we're both live on TikTok and YouTube today. We've never done this before, so what we're actually doing is showing you the whole process from consultation all the way through to the treatments that this patient's going to have. This patient's never been here, she knows nothing about us, she has some insecurities, which is where we are at the moment, and Nurse Bina has just asked her about her medical history and what her concerns are. So you were just about to tell us, weren't you?
Yes.
Which are what?
What the insecurity
Yeah.
is probably my face. I feel like it droops a little bit here, and then obviously my chin is a big one under here, and I have got like a little dent here that is insecure as well.
Okay, so let's start with the day. So track down. And have you had Botox before?
Never.
No Botox. Okay, track down. Look up.
You would think I have because I can't find. I know.
So we can put a bit of Botox to help that, but we can also fill it with a bit of filler.
Okay.
Just
can you see where the different is?
Yeah,
if I was to take off the makeup, you can see.
I'm gonna wipe and have a better look at it. But so that's the two options that we can go for. And then in terms of your chin, so it's this bit, isn't it?
Yeah.
So we can try to dissolve that with some pine bottle we have, which is basically helps dissolve the fat cells, break them down. And then what your job is to do is to drink lots of water, massage it out of your lymphatic system, and drain it out. So that can help with that. Also, we can, in terms of you saying your face is a bit drooping down, we can do lower jaw threads.
Okay.
That'll just help lift your jaw a bit. In terms of your cheeks, how do you feel about your cheeks? Because your cheeks, to me, personally, I don't think they're like very droopy or anything. They hold pretty well. But what do you?
I think my cheeks are fine.
Yeah.
It's just mainly this part, because I feel like this has got more like a fatty tissue than this side.
Yeah, so you just want it more stretched.
That's it.
Yeah. Okay, so we can do some lower jaw threads. And then how threads work is basically, so we insert it into the skin. They dissolve in 6 months. But what happens is once they dissolve, your body rushes collagen to that area, and then that kind of mimics the hold of the threads, which you have that hold for about 2 years until your collagen starts to wear off, and then the threads droop. Yeah, so that's a bit about how we do that. And we also inject lidocaine, so it makes it very pain-free.
Okay.
So it's pretty nice, chill procedure. So do you want to start with the crease on the forehead first? Try to do this.
So good afternoon. If you've just joined us, we're doing something we haven't done before. So often what happens is we do these lives and we show you from the time that the nurse has done all the preparation and done the consultation. But what we thought we would do is show you everything from the beginning, because a lot of you have asked us, never been to aesthetics before, a bit nervous, not sure what goes on. In fact, you were like that yourself, weren't you, Tina? Yeah, she didn't know what went on. So we thought Tina was like, I'll help, and I'll do my journey live on TikTok and YouTube. So if you just joined us, all you've missed is the nurse has done a consultation, looked at her medical history, had a look at her face. She's about to take all her makeup off, and it looks like that what we're going to end up doing is we're going to be doing some Botox and fillers on the upper part of the face, and then threads at the bottom. So if you've never seen Botox live before, then this is going to be a great opportunity for you. If you've never seen threading being done, then that's another great opportunity. So stay with us. It's going to take a while, because you'll see the whole process that's not edited or recorded prior or anything like that. So it's going to be a good one, I reckon. So Tina, talk us through your life then. You've never had anything done?
Never.
How old are you?
I am 38.
Is that including Sundays? You look about 10.
It's a good genes, I think.
Good genes.
It is.
But I think what's interesting, I don't know what everybody else's opinion online is, but you look really young.
Yeah.
And often what people will say is like, what's wrong with you? You look perfect. Your skin looks good, everything looks good. But it's all about insecurities.
It is.
All about how you feel, not how I feel or the nurse feels or whatever. It's how you feel inside.
And it's obviously I'm okay with, I feel like, with makeup, but then even with that I still won't take a picture with a normal camera with my makeup on because of my insecurities. But you will see once the makeup's off, you'll see I'll probably do look my age.
Yeah, well, we'll soon find out. Hi Annie. Are these treatments very expensive? Not at all. The Botox and fillers, we've got an offer on at the moment, so Tina will be paying 250 quid for the Botox and fillers, so that's not a lot. And then the threads, there's another offer on with that as well, so it's about 320. So what's that? It's 520, about 500 quid all in, I'd have thought. So not when you think what she's getting. How many sessions will she need? So for the Botox, she'll need another session in 12 weeks. As far as the threads are concerned, she won't need nothing for 2 years, so that's good. PRP, we're not doing PRP on this particular patient, but PRP is effectively 2 years. Hi Annie, we're based in Brentwood at the moment, so this is our Brentwood clinic, but we're also, our main clinic is in West End, in just between Tottenham Court Road and Oxford Street. We're a company of 3 actually, so we're a medical company. So at the moment you're looking at 65Medical. So this is where nurses will do medical procedures like threads, some Botox procedures and some filler procedures. The reason why Tina is under the medical today is because to stick filler in that location, you need to be an advanced nurse. You have to be an advanced nurse to do that. And threads, you have to be advanced as well. And what's also good about Tina, she's an ex-surgical nurse, so she worked in Great Ormond Street for a number of years and therefore was doing sutures on babies. So this is going to be really good. I'm really excited about this one. Tina's starting to take the makeup off, and
yeah, you can see the little mark now on my forehead and my insecurity.
It's like when you wake up in the morning and go,
I don't
where
like
did you
it.
come from?
Yeah.
The bar. I'm only joking. I wake up in the year too, and no problem. Right. So and treatment, no laser treatment at the moment. So what you're watching the nurse do, everybody that comes into our clinic, whether it's under beauty or medical, we do a full facial. So we've partnered with Eve Taylor. So she's taken her makeup off and given her a proper cleanse. And she's never had any work done. So no Botox, no fillers, nothing. So it's her first time in clinic. She's a bit nervous.
I am.
Sweaty hands.
I am.
She's sweating
I'm
up.
like literally praying.
She's definitely sweating up for sure. But you know what? You're in good hands.
I
And
am.
as far as pain is concerned, you're going to feel nothing
I
because you're
hope
going to be
so.
totally numbed up.
Yeah.
I think the nurse will take some pictures once the makeup is done. That's a very good point. She does like to forget the before and after photos. And also, we're going to talk about your weight later. So you've come to have a look at the Ozempic pen, which is for weight loss. So we'll be doing that one as well through this live. So hi, Lady Grace, good to see you. If you've just joined us, welcome to 65Medical. We're live on TikTok and we're live on YouTube. We're with this patient today who has never had anything done, and she turned around to us and says, you know, she's really nervous, never knew what really went on in an aesthetics clinic. So we had this idea that rather than just showing you the treatment, we've shown everything. So if you missed the start of this live, the nurse went through her medical history. She's gone through all of the things that the client wants and what the client's concerned about. She's now cleansing the face because everything we do starts with a full cleansed tone before we do anything, and then we repeat that process at the end so that when you leave you look like you've actually been to a spa rather than had needles done. So what we're going to be doing on this patient is threads on the lower part of the face. We're going to be doing pine bottle on the chin here, some Botox on the forehead and some filler on the little dent in her frown. Now, the reason why we're doing Botox, if you try and lift your eyebrows up, can you see where she's got no lines? Now this lady's 38, bless her, with no lines. So, she's got away with it. But at some stage those lines are going to come because that's the way the body works. You can only get the lines by moving the frontalis. So by Botoxing this now, as long as she keeps up with it, when she's 80, it will look like this.
Good.
So you'll have no lines. So one of the big misconceptions is that you should not Botox if you haven't got any lines. Well, it's actually wrong. So we encourage people to start early 20s so that you don't have any lines. Also, nurse, can't Botox help with acne and stuff like that on the forehead?
Yeah, so if you have like that kind of acne where it's like lots of little pimples, they're just hard to get rid of, and Botox, because of its toxin, helps to freeze that and just kind of kill the little bacteria. I have personal experience on
You
that,
have
so
personal experience of that, for sure.
But you can see it now where you couldn't see
Yeah,
it with the makeup
we can
before.
see it now for sure.
Yeah.
What's the difference between Botox and fillers? That's a super question, and these are the sort of questions that we're looking for, because what we're not doing here is trying to sell our services. What we're trying to do is educate and help you so that you can make some informed decisions. So the difference between Botox and fillers, if we Botox this area, then we're going to stop the brain sending notices to the muscle to move. So she won't be able to frown and she won't be able to lift her eyebrows up very far. And that stops the lines and freezes her out. Fillers will fill a dent. So you see where she's got like a little line here on the nasal fold, or she's got this dent on her forehead that she's upset about. That actually fills the hole. So filler will fill something, Botox will freeze it. And we're going to be using both for this lady today. Filler tape lasts about 2 years, filler lasts 12 weeks because the brain will try to do it. So you can see, look, she's got zero movement. Go on, do it again. So you actually think that she's got Botox in her, but she hasn't. So one of the benefits, nurse, is you can use a small amount of Botox, I guess.
yeah, exactly that.
So
I'm actually surprised that I don't have any lines.
So she's going to use a small amount of Botox on here. Hi Nick, what can you do for the hollow dark circles under the eyes? So this is a really common issue, these dark circles. This Tina hasn't got any. We use PRP for that, or PRF, and that will help with dark circles under the eyes. You need a couple of treatments. It's around about £350 all in, and you will be done. So the skin's looking really good, Nick. You've got a naturally strong jaw, which all we're going to do enhance with threads. And she's got lovely cheekbones, nice lips. Yeah, she's good. We like it.
Got it all.
She's got it all, yeah. Turkey teeth.
Yeah, I wish they could be straighter, whiter.
I'm gonna take some before and after photo.
Okay.
Poor miss me.
It's my dark circles. Yeah, Nick, we can definitely do that for sure. Hi, Erica. Chin sculpting can be either done with machines like radio frequency machines, or it can be done with filler. So it's just changing the way the chin looks. Are her teeth real? Trisha, I'll ask.
Yes, they are.
Let's have a good look.
They are. And they're not even straight as well. I've got my insecurity
Never
here
tap.
as well.
Yeah, they're real.
They are.
So they are real, Trisha. Yeah, they are real. So Laney Lane, hi. How long does Botox last? 12 weeks. Botox hates exercise, hates hot weather, hates steamy weather, hates sauna, loves water. So it will last
Drink
about
lots of
12
water.
weeks.
Yeah.
We guarantee it for 12 weeks anyway. So if you were to come to our clinic, even if you were a gymaholic and you trained all the way through, we'd still do it, no questions asked. So 12 weeks. So we're Botoxing someone for the very first time.
Yeah. Okay.
So let's get
There's
nice
a really
and
tiny
close.
little thing
Oh,
we'll get
okay.
in the end.
Here goes the person that's never had
Is this
Botox
filler?
before. No, this is
No, this is
Botox.
Botox.
Hold tight.
Breathe in and out.
First time in 38 years this patient's had Botox, never had Botox. And this nurse qualified about 20 minutes ago, so that's a joke.
Yes,
It's a joke.
I'm just
It
thinking
was
of
30
me on
minutes
holiday
ago.
on a beach, so I'm alright.
How did that feel?
Do you know what? It was just a little scratch.
Yeah,
It's fine.
it's tiny, tiny
Yeah.
needle.
Yeah.
So, and we only put a little bit in anyway. Now, what the nurse is doing? Talk about how you make sure you don't get eyebrow issues like drooping or spock eyes. What do you
So
do?
what's important is to balance the Botox in both the muscles, and so this is the corrugator muscle, which helps with pulling the muscle in when you're angry or frown, and then this is a frontalis muscle, which helps. I don't know how to explain
Lift up, yeah.
lift
Okay.
up and lift down the eyebrows. So it's important to balance them out, because when you don't, that's when things can droop or there's spot brows. So yeah.
And the good thing about this patient, where she's never had Botox and she's got no lines, if she keeps it up now for the next 10 years, she'll get no lines ever. It's not physically possible.
wow.
So
Is
that's
it?
so the
love
best
that.
the best thing you can give your 24-year-old is Botox, I think.
Right, that's what
Just
we're getting.
preventative.
Can we start at 20? 20 next
So
year.
as soon as you can. I mean, I wish I could. So if you'd have gone back in time. So right. So I'm going to just give this camera to somebody else in a minute, because I've just got to go and do some dissolving of a upper lip for somebody. But got people live, have you? So you can see now that she's doing the upper body. How's it feel, Tina?
It feels fine. I was actually really
You
scared.
were scared, weren't you? I
I
think that's why we
was.
started with the Botox. So really good to see. It's not as bad as you thought.
No, it's not. So it's like the filler, the same as the Botox, like the needle and stuff.
So the
like
needle,
that.
yeah, she's going to put it into the Botox needle, because that area is really
Oh,
sensitive. So
okay.
she'll decant it into a Botox needle, and then it will feel just the same.
Okay.
Hi, if you've just joined us, this is a bit of a first for us in 65Medical, because we've actually demonstrated the whole process from the time this patient came in. She's never been in Essex before. She's never had anything done. She was really nervous, and we've finds it there. Because she spoke about her issues about coming to an aesthetics, we agreed it'd be a really good thing to do live, so we can demonstrate what really goes on, especially if it's a newbie like this one. And what are you feeling now?
Actually, no, I actually feel
She's not sweating.
I'm not.
No,
I've calmed down a little bit.
she's calmed down.
Yeah,
And,
it's not as bad as I actually
as
thought
you
it
thought.
was. Yeah.
So, Nurse Bina, what are we doing now?
So now we're gonna prepare the filler. So we're using fine filler. This is a good consistency for any fine wrinkles or any like fine lines that you want to get rid of.
Okay, so that my little dent.
Yeah, like
It's your little dent. So this dent for us looks like a very little dent, but in your eyes it's huge.
Yeah. Oh my gosh. Yeah. And I can still see it when I put makeup on. That's why to me it's huge.
See, that's the other benefit that you're going to see with Botox, because Botox makes you smooth. When you put your makeup on, it's going to be like a smooth ice rink.
Oh, I love that.
So it does make the makeup fit so much better. On that subject, there's loads of places we can put Botox. We can put it here in the masseters to stretch out the face. We can put it here to lift this up.
So
A whole bunch of different things.
So
So the
It
nurse
just
is
feels
just
like there's so
double
much
checking.
in there, isn't it?
Just double checking what the entrance is.
No, I don't know what it
You can
was. It's
see
always
the
been
area
there.
that she's concerned about.
It looks like it's a hole kind of, you get what I mean?
Yeah.
Is there something in there?
No, I don't know what it is. Should have done my eyebrows before I come though.
Okay, we'll fill that little bit in and see.
Yeah, so it's a tiny hole that we're going to fill, but obviously when Tina puts her makeup on, it causes her some little fits
Yeah,
of
it
grooves.
does.
Does it
And
feel like there's anything in there?
No, because I tried to squeeze
Yeah.
it because it looks like it's a hole and there'll be something in there.
Yeah,
but
no.
nothing's comes out of
No,
it. It's just
no.
open.
Yeah, yeah.
Gosh. Now, obviously, it'd probably be makeup that comes out.
I was going to say, wouldn't it be funny
Maybe.
if an alien came out?
Oh God, can you
All
imagine?
loads of little spiders.
I love
Go
it. I'll
TikTok
collect them.
live.
Oh my gosh. Yeah. Oh, my skin looks terrible. Okay, I don't even want to look at that.
It doesn't look that bad. Tina.
Oh, I feel like it does.
So, hi, if you've just joined us, we've done the whole consultation today, something we haven't done forever. I can't remember the last time we did this. So, the reason why we've done this is this patient's never been to Essex before. The nurse, what are you doing now? You're decanting, are you? Why did you decant?
Just so we can use a little needle. It just helps with preciseness as well. And we'll put it into a Botox needle.
So if you just joined us, we've demonstrated all you've missed is the consultation part where we discussed the insecurities with the client, we've checked the medical history, and the nurse has done the Botox. We're now doing some filler just to fill a little dent on her forehead that has been driving her mad for a little while. So let's get nice and close to that. Now the reason why she's under medical for this is the advanced aesthetics treatment that only nurses of certain grade should do, because you've got a major artery that runs up through the face, round the nose, past that part, and then down up and serves the brain. So you don't want to be touching that if you are not of a certain standard, and especially if you're not a nurse. Would you agree with that, Bina?
Yeah, definitely.
Because what Bina's doing, which you can't see, is she's listening and feeling for a pulse as she's doing it. She's going superficially in, so she's nowhere near that artery.
That sounds so scary when you say that.
You're in the right hands, bud. It's because people don't check.
Yeah.
So other people just go to these
Okay.
flashy websites or
Yeah.
these great Instagram accounts, and then young girls that have just passed, who haven't even learnt that,
Yeah.
will just do it.
And then that's when they have the issues.
Yes, that's a really good question about aspiration. Thank you for that. Because we're using a Botox needle, there's no need to aspirate. If we were using a larger needle, there would be, but also what's happening, the nurse is using her finger to feel the pulse of the artery. So that's what she's doing. It's a very advanced move, so you're spot on. So if we were doing normal filler here with a normal needle, then she would be aspirating. But with a Botox needle and this particular technique, you don't need to. But no, don't thank. It's a perfectly good question. That's exactly why we're doing it.
Tina, look at the mirror. I just want to show you something.
Right, so
So can you see
Kayla Shah, complications with eyebrows lift on Botox
Yeah.
on at all if it's done
Yeah.
properly.
So it's really, I feel
Hi
under it.
Joe.
That skin has to be closed, if you get what I mean. for
Yeah.
that to
It's like a
disappear.
scar.
Yeah, it's like
Okay.
a scar almost.
Okay.
So that's the most I could do. I feel under it, but
Yeah.
that skin needs to kind of heal
Yeah.
and join together to get rid of this little
Maybe a bit
open.
of
Okay.
PRP.
Yeah, just to
Okay.
get rid of that openness.
But it's filled
Yeah.
now.
Okay.
Hi Joe. So what we've done, this lady here, this Tina, she's come to us, and the reason why we're doing it
But
under
it'll
medical
probably heal and then it'll
rather
probably
than
just
doing
Push
it
up.
under
Yeah.
Push up.
65 beauty
Yeah.
is because we're doing some really advanced procedures on her. So at the
Yeah.
moment, Nurse Bina is using filler to
So it's probably
treat
like a
an old
scar
scar.
then,
It is.
Because look, it just, the filler came out of it.
Yeah.
So it's like a hole and it just kind of
Oh, okay. Squirt it out.
squirted out of
And
it.
we've
Yeah.
done the whole
So if I go in there,
consultation
Yeah.
live, so we showed you what goes on.
Oh,
Oh, look, it's coming out of it.
We've
So it's a
also
Yeah, it's not
done all
healed.
the medical
Yeah.
history live, so you can see what goes on. Why blood? Because it's a needle. Right, so the advice that the nurse has given is that she's filled under the hole,
Yeah.
but the skin now needs to repair on top. So I think we'll take a bit of your blood later and we'll do a bit of PRP for you.
Okay.
To help it.
What does that? What's
So
the
PRP is what your, so if I stabbed you now or cut you, your blood would rush to that area
Yeah.
to close the wound
Oh, okay.
and build new skin
Start
around
healing.
it. So we're going to take your blood and stick it straight into that area that we want. So all the good
Oh.
parts of your blood.
Yeah. So it's
I wish you were closer to me, Joe. So do I. Does this flatten the surface of the scar? Really good question. Yes. Well, we've gone under the scar, and then we're going to use PRP on top of it. I've just had my filler dissolved. I was blocking my lymphatic. Yeah, absolutely. There you go. That's another important point. So I guess that was done by a non-medic, not realising about lymphatic drainage. Scary stuff. Hi, and Hannah, is it? No, PRP won't affect the filler. You can perfectly do PRP on top of filler.
always going to be there, isn't it?
No, it's
No,
not.
it's
No,
not
it's
healed yet.
It's not
But it's
healed.
been there for ages.
So what
It's
she's
not-
done,
'cause when
she's
she's-
filled the hole,
Yeah.
but now what
It
she
was
needs to
coming
do,
out
she needs to
Yeah.
grow
of the hole.
She needs to grow the skin up. So we're going to use PRP to put on top of that. Here we go.
It's going to help
Okay.
quicker.
Good.
Okay. So now we'll do the threads.
Joe, I know, darling. Yeah, you do. The problem with things like Monjaro and Ozempic, you can easily look gaunt.
How many threads is it?
You might want
Two on
to
each
just
side.
think
If you
about
need more,
increasing
you
your
put
fruit and
more.
veg.
So
Give us a
what
call
do you
and we
do
can
with the
talk
threads?
about
You
it.
put them and then-
So we make an insertion hole with the needle.
Yeah.
Then the threads are attached to a cannula like this,
Oh, okay.
and that goes through that entry hole.
Yeah.
We pull away the cannula, but the thread stays in there.
Oh.
And then we pull the threads to the tightness you want, and
Yeah.
then we cut it off.
Oh, okay.
So if you've just joined us,
And it doesn't
you've
either.
missed the Botox and the filler part of this.
Just that
This
entry hole,
patient
don't
has
we?
never had anything done, and she's come to us as medical
Just that bit.
because what she
Might
wants
be
is
a bit
all
swollen,
advanced techniques.
But over a few days, that will just
It'll
go
be
down.
fine,
Yeah.
Yes, threads will dissolve after 6 months. So what you're now watching is the nurse doing the consultation for the threads. And talk us through what you're doing, Bina.
Yeah, so I'm just marking up where we want the ball. So if you have a look in the mirror as well, so if the entry hole's there, and there's one coming down this way, and if one comes down this way, I would just do that.
And that will pull. So she's now showing the patient how it's going to look when it pulls.
Okay.
And if you need more than two, we put more.
Yeah.
Yeah, it'll just be a subtle little lift. Subtle like that.
Yeah, it looked lovely.
Okay.
Right, can you hold this for a second on your other
Then
arm?
that wouldn't.
Well, unless you want it
Just take that off the-
way,
Yes,
or
please.
Hold that
a
one.
bit. I just do
Yeah.
just to make the jaw fit.
Yeah.
So we'll go like this, and then if we need one here, we can just go in here instead of
Oh god,
maybe doing the lemon ball.
Yeah.
that's
Yeah.
wobbly.
So
Yeah.
I'm going to go
So
quiet
I'll
for a
try
minute
it there.
because I need to look after
We'll
the
see how
patient.
it
But
goes.
Bina will
Yeah.
get
Try
the,
get
Yeah,
ask
Bina
any
to answer the
questions.
We'll
questions.
see from there.
Okay.
So we'll do 2 here, 2 down here. So just go here under your
Oh.
chin.
Or the lemon, do you think would be, or the
Lemon, the pine bottle basically dissolves some fat cells.
Yeah.
But you might need another session. It'll do a bit, but whereas the threads will pull it a bit.
Oh
So it
yeah.
depends what you kind of want.
Just to define it really. You know, like
Yeah.
the sides. It's like you don't have a nice side profile. Just want
Yeah,
it
so maybe
defined.
threads is probably nice up under here just to pull that back as well.
Yeah.
The chin with the jaw.